You look at our population of just our membership.
We're all young.
We're all young. You sit around that circle that once a month when we meet, and you don't see faces of 50 and 60-year-olds.
Right.
And most of us had our diagnosis when we were in our early to mid 40s.
Right.
And clearly, some of us would not be here now.
No, I don't think
we wouldn't be living
right.
then.
Exactly. So.
Giving some women relief and causing others confusion and frustration, a government task force this week said that most women don't need mammograms in their 40s and should get one every 2 years starting at age 50. That's diverting from the American Cancer Society's long-standing recommendation of annual exams beginning at 40.
I think the confusion is tremendous. I mean, already the scare and the fear is that women say, like, I got used to doing my annual mammogram, I got used to doing my breast exam. You can't go backwards from that. That's a very hard process to tell a 42-year-old woman you're not going to get a mammogram now for 8 years and stop doing your breast exam because you know what? The government doesn't think it matters that you save a life, because the stress of you having to potentially go through a benign biopsy, they're more worried about that anxiety. But we worry about the anxiety of the husband who's burying his wife at the age of 45 or 46 because she has a breast cancer that was found at an advanced stage because she wasn't getting screened. My guidelines haven't changed. I still believe that women should have mammograms annually from 40 on. I believe that women should do breast self-exam because they own their breasts. They know their breast tissue. To make the assumption that a woman can't handle the anxiety or that they cannot discern that something is good or bad, if they feel their breasts and they notice a change on their breast exam, they're going to be the first ones that are going to come to their doctor. But if they're not checking, by the time they find something, it may be too late to be curable.
I am a breast cancer survivor, along with Anne, and I have a lot of breast friends in our support group that are between the ages of 35 and 45. And quite honestly, that, if those people had not gone ahead and had a mammogram or had self-exam and found their lump, they wouldn't be here today, including myself.
Breast self-examination can be a good thing when women become aware of their bodies. The only downside to it is that sometimes it becomes almost obsessive to the point where women examine themselves daily or weekly. And doing it too often, especially because of the hormonal variations that go on in the body, can cause, again, stress, confusion. So done monthly, it costs nothing and leads to an awareness of the body so that you're aware of change, which is good, but not overdone. The question is, does it save lives? And that we don't really know, but mammography, absolutely.
Area doctors said they'll still be pushing their patients to start getting mammograms at 40. Reporting for the Bucks County Courier-Times and Intelligencer newspapers, I'm Rachel Canelli, and that's The Buzz in Bucks.